Welcome to MedEd 360. Today, on World Diabetes Day, we're discussing something incredibly important: the mental and emotional aspects of living with diabetes. According to the latest estimates, over 500 million people are currently living with diabetes, with 1 in 8 people set to be affected by 2045. Living with diabetes is not just about insulin and blood sugar levels. It's about mental resilience, battling stigma, and coping with the stress that comes along with it. Let's dive into how diabetes impacts mental well-being and explore why this year's World Diabetes Day theme goes beyond physical health. The International Diabetes Federation, IDF, is an umbrella organization of over 240 national diabetes associations in 160 countries and territories. Its mission is to improve the lives of people with diabetes and prevent diabetes in those at risk. The federation has been leading the global diabetes community since 1950. World Diabetes Day was created in 1991 by the International Diabetes Federation and the World Health Organization in response to growing concerns about the escalating health threat posed by diabetes. World Diabetes Day became an official United Nations Day in 2006 with the passage of United Nations Resolution. It is marked every year on November 14th, the birthday of Sir Frederick Banting, who, along with Charles Best, is credited with the discovery of therapeutic insulin in 1921. This year's theme is Looking Beyond Blood Sugar, to emphasize the need for a comprehensive approach to diabetes care. Today, we'll focus on the mental health challenges associated with diabetes, which are often as significant as the physical aspects. A new global survey conducted by the International Diabetes Federation, IDF, reveals that 77% of people living with diabetes have experienced anxiety, depression, or another mental health condition because of their diabetes. While diabetes affects both physical and mental well-being, care often focuses only on blood sugar management, leaving many overwhelmed. We need to look beyond blood sugar for a better diabetes life. Now let's talk about some of the key psychological impacts of diabetes. First is diabetes distress. Around 36% of people with diabetes experience what's known as diabetes-related distress. It is due to the constant demands of managing the condition, from regular blood sugar monitoring to strict dietary restrictions. It can feel like there's always something to worry about, which takes a toll mentally and emotionally. Imagine waking up every day with the responsibility of controlling a chronic condition and the fear that a single misstep might lead to complications. Next comes another mental challenge, that is the fear of long-term complications. Research shows that about 63% of people with diabetes worry about serious complications like heart disease, kidney failure, and nerve damage. This constant fear and worry can lead to chronic anxiety, and some people may even become depressed. It's a harsh reality that living with diabetes means knowing that even with diligent care, there are risks that can feel overwhelming. Lastly, managing diabetes can feel like a never-ending task. Around 28% of people with diabetes report struggling to stay positive. The emotional strain comes from the burden of managing this condition every day. It's easy to feel helpless or burned out, especially when facing fluctuations in blood sugar that are sometimes beyond your control. Now let's talk about another aspect of living with diabetes. Beyond the internal struggles, people with diabetes often face social stigma and discrimination. Some people may not understand why someone with diabetes needs specific dietary or lifestyle adjustments. Others might react insensitively or believe outdated stereotypes about diabetes. Because of all this neglected emotional and psychological aspects of diabetes, taking care of diabetes isn't just about insulin and diet, it's also about maintaining mental health. Studies show that people with diabetes who have access to psychological support experience better outcomes. Counseling, support groups, and other forms of psychological help can make a significant difference. These resources can offer coping mechanisms, help with stress management, and provide emotional support, making it easier to handle the daily demands of diabetes. Holistic care that includes mental health is essential for long-term well-being. After getting to know about the mental aspect of diabetes, now comes another important part, that is, how can we help these patients? Mental well-being is not something that most doctors are concerned about, because in the consultations they are focused on treatment, on reading the labs, on prescribing. When someone with diabetes comes to the consultations, if we see that person as a person, not as a patient, we're seeing a human being. so we will treat them differently. If we do that with every patient, the world can change. If you know someone with diabetes, you can support them by being empathetic and understanding. Sometimes, a little encouragement or acknowledgement of the mental load they carry can go a long way. We can all play a part in reducing stigma by educating ourselves and creating a supportive environment for people with diabetes. It's these small acts of kindness that can make a huge difference. After understanding the psychological struggles and distress that people with diabetes often experience, I encourage each of you, whether you're a medical professional or simply someone who knows a person living with diabetes, to reach out on this World Diabetes Day. Let them know you recognize the challenges they face with this chronic condition. Acknowledge their resilience, offer your support, and show empathy. Even a small gesture of understanding can make a difference in their day and remind them they're not alone in this journey. Thank you for watching. Today, we explored a side of diabetes that often goes unnoticed: the mental and emotional challenges. Remember, managing diabetes is more than just medication and blood sugar control. It's also about compassion, understanding, and mental well-being. If you found this video helpful, please give it a like and subscribe for more informative health content. Share this video with someone who might benefit from it. Together, we can make a positive impact on the lives of those living with diabetes. Leave a comment below with your thoughts on how we can better support people with diabetes. See you in the next video. Stay blessed, live healthy,